All right, and I'll start again. Welcome everyone to the Better Breathers Club of BC. Our last meeting before we break for the summer. Tina and myself and men from BC Lung will be busy planning our new season that'll start back up again in September. You can let us know actually in the chat today, or perhaps at the end of session, if there's any particular topic you'd like us to look into for you for our next season. Please do let us know. We're always open to your feedback and ideas.
Yep.
So I'd like to introduce Tina, who's going to get us started. We'll share the screen. We are talking, of course, about breathing emergencies today and what to do if you happen upon a breathing emergency.
All right, let's play with our tech a little more here. Let me try a screen share. All right, is everyone seeing that slideshow up here? Okay. Awesome. So welcome, Better Breathers Club of BC. Everyone's welcome, sponsored by the BC Lung Foundation, where we're being broadcast for you today, and brought to you by Poplar Pulmonary Wellness. We would like to take a moment to acknowledge the unceded ancestral territories on which we live, work, and play, and that we're on today. These are the unceded territories of the Coast Salish people. That's the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And if you'd like to pop in the chat, the territories that you are live, work, and playing on, please go for it. All right, so our Better Breathers Club, we'd like to create a safe space for everyone where you can share your thoughts, values, and opinions and ask questions without fear of judgment. And so we thank you in advance for creating this safe space for everyone. And a little reminder that the information shared here is for education purposes, and it doesn't replace or substitute professional medical advice from your particular healthcare provider. All right, the topic of the day is breathing emergencies. And when it comes to breathing emergencies, we thought we'd break that down into three big areas. So what are we talking about? How do we treat them? And can we prevent them? And as we go here, feel free to ask your questions anytime. So if you do have a question, you can raise your hand like actual or Zoom wise, and we'll get to that. You can also post your questions in the chat. Jenna's going to monitor the chat for me. Thank you. And we'll get to all those questions too. All right. So before we start, we wanted to pick your brains actually and find out what you thought we were going to be talking about when we say breathing emergencies. So if you wanted to unmute yourself and just share with us, what does this bring to mind? What do you feel a breathing emergency is? And if you'd like to share a personal story, go for it. Let us know if you have experienced a breathing emergency in the past. Sure, go for it, Bev.
Instant panic, where you're, for me, it's just so much phlegm in my nose and my throat, and I just can't get any air in, and I just panic, and it all makes it all worse.
Yeah, I think you hit the nail on the head right there, especially with the panic. Yeah, so you have experienced this then for sure. Yeah.
Many times.
Yeah. Okay, thank you. Jeannie.
Yes, in 2023, I had experienced low blood oxygen levels down in the 70s, and I couldn't get it up to 88, even with oxygen. So I ended up having to call an ambulance and going to the hospital. So there I was treated for hypoxia and an interstitial lung disease flare. So I was in hospital for 10 days. However, I was able to get out 2 days earlier than predicted. So I guess I did pretty well there.
Well, we're glad you recovered and quicker than usual, but that is certainly a scary situation. Thank you for sharing that.
And bringing up a good point that breathing emergencies for sure might land you in the hospital for emergency care. Yeah.
Absolutely. Yeah. Learning when to get help and what kind of help to get is important when you're managing these things too. Thank you. Is there anyone else you wanted to share before we move on?
I had one a couple of months ago that really kind of shook me up pretty bad. As you know, I told you I had a bit of a fall and originally thought I had only cracked a couple of ribs, but all of a sudden I found myself on the ground with the wind knocked out of me and not having the support to be able to take a deep breath to restore my breathing. And actually was sitting on the ground for probably 5 minutes to get my breathing before I could settle it down, that I could get a breath. And it still, I mean, it's been 2 months. I still can't take a deep breath, but it's now under control, whereas before it wasn't.
Wow. A long 5 minutes.
Very long 5 minutes.
Yeah.
Yeah. Even 1 minute seems like a very long time when you can't breathe. Thanks. Thank you, Alan. Did anyone else want to share?
I have a question.
Sure. Hi, Rick.
Hi, I've got a question. I've been pressure washing this morning and I just volunteer around the community I live in and moving people's potted trees and plants and stuff like that. I can keep my oxygen somewhat, say 91, I might drop down to, but what I don't understand with the oxygen, why am I so weak and can barely stand at times, even though my oximeter says my oxygen level is up? What is happening? And I don't understand the oxygen therapy issue at all. It's never really been explained to me. So I did come in before this thing and just laid down for a bit, put my oxygen on, and not as, but I know I can't go out and do stuff, and yet my numbers read really good. I'm at 98, and that's but I have no stamina. So
Okay.
where's the correlation between your oximeter and how you feel?
Perfect. This is a deep question, Rick. I love this question. Great. I am glad you brought that up. There is a point coming up in the slideshow where I will address that, if you're okay to wait just a moment, because there's multiple factors that can come into play with a breathing emergency. Yeah. Great question.
I think that's the most common question I've ever heard in the COPD community. And I have that question as well.
Awesome. We will do our very best to answer that for you today. Okay. Thanks, Mitch. All right. Thanks, everyone. Wow, this is great. Oh, Jeannie, did you have another question? Oh, you're on mute.
I was wondering how sleep apnea is affected with low oxygen levels or like tiredness in the day.
Yes. So sleep apnea is when people stop breathing or don't breathe enough when they sleep. And often we'll do a diagnosis based on their oxygen levels. Yes. So sleep apnea can cause oxygen levels to drop. Yeah. And if you're living with a chronic lung condition where your oxygen levels might be low to start off with, or maybe you use oxygen in the day, you might be more sensitive to having sleep apnea and certainly more sensitive to the effects of that. Yeah, so very important to get treatment for sleep apnea if you suspect you might have it. And you can get tested for that going to a sleep lab where you sleep and they hook you up and monitor you and they can diagnose it. And it's treated with a machine that you wear on your face at night with or without oxygen. Awesome. Great question, Jeannie.
Just
Okay.
a quick hi to Elaine that's just joined us as well. Hi, Elaine.
Hi, Elaine. Good to see you.
I missed the meeting this morning.
Ah, well, welcome to it. All right, we're talking breathing emergencies. We'll push through a little bit. Um, so I would like to acknowledge that having a breathing emergency gives like this anxiety feeling, like Bev was mentioning. So when you're in it, and that's those, those 5 minutes or those 1 minute or 2 minutes even where you can't breathe, it can be traumatizing, right? So this is an emotional experience. And once you've had one breathing emergency, we know that that fear of it happening again can cause anxiety sort of in a ongoing way. And especially if you happen to have had more than one of these situations. So we do recognize that living with a chronic lung condition, because of these breathing emergencies and shortness of breath that can occur, we know that this is an emotional journey, and we wanted to recognize that. And so by learning about breathing emergencies and what you can do about them, we hope to bring down that anxiety level, knowing that you have a plan if something happens. So that's also our goal for today. All right, let's get started with some sort of defining terms here. So when we say breathing emergency, we're talking about what we call respiratory distress. You can also call it difficulty breathing or shortness of breath. Okay, so a lot of times if you were watching somebody go through this or experiencing it yourself, you might notice that there's this gasping for breath. People usually want to breathe in through their mouth. Mouth might be wide open, or what we call a guppy breathing, like really reaching for each breath. You might see their nose flaring out a little bit, our muscles working harder. So when somebody's going through a breathing emergency, it's often something that a bystander can see. We also notice that people tend to breathe fast and shallow when we have this. So like kind of a hyperventilating state, but we're not breathing very effectively when we breathe that way. Having a breathing emergency can be uncomfortable or painful with the breathing, with those muscles working super hard. And if the breathing emergency isn't handled, then it can lead to respiratory arrest or respiratory failure. And this is what Jeannie was mentioning, that she knew her blood oxygen levels were low and they weren't coming back up. So then you do need to go to emergency, go to the hospital and get more emergent treatment. So we'll talk more about what we can do about the breathing emergencies and when you might want to call for help.
Respiratory failure.
So there's another term that we use, which is called respiratory failure. And this is a more technical term. And this is talking about the inability of the respiratory system to provide oxygen or to remove carbon dioxide from the body. And working in the hospital, if somebody comes in with trouble breathing, that's one of the first things we're going to check. We're going to do a blood test, and we're going to see if they actually do have respiratory failure and give the proper treatment. And so in order to check that, we'll check things like you can put a little clip on your finger and we'll check the oxygen levels, but we can also check that more accurately through a blood sample. And the blood sample also tells us about carbon dioxide. So we had some questions at the start about, why am I gasping for breath? I'm tired, I'm having trouble, doing activity. I know I can't just get up and go for a run, but my oxygen levels are okay, but I still feel short of breath. And we see this a lot. And one of the problems that could be happening is that the carbon dioxide is building up in the body. And when we have carbon dioxide, so our body makes carbon dioxide, that's the waste product of cellular respiration. So our body makes carbon dioxide and we get rid of it by breathing. So when we blow out, some carbon dioxide leaves, and then when we breathe in, we're breathing in some oxygen. And so when we're moving the air in and out, this is ventilation, and that's what gets rid of the carbon dioxide. And if we start to move, we start to, get up and go to the kitchen and make something to eat, our muscles start working and they make more carbon dioxide when we use them. And then that means our body has to breathe more, we have to ventilate more to get rid of the carbon dioxide. And so often when it comes to doing active things, it's the carbon dioxide that we need to get rid of that causes that feeling of shortness of breath. So the oxygen need is also very important. We all talk about oxygen a lot, and for sure it's important, but sometimes the shortness of breath can be driven by higher CO2 levels. And that drive to breathe can be just driven by the CO2 level itself, not even the oxygen. Oxygen is also a problem, and that can also cause shortness of breath. So we do these blood tests if you go to the hospital to figure out which one is the problem, and then we would treat that one. Or it can be both. It can be both. So if you stop breathing entirely, both would be a problem. Yeah, so when we move around, it's usually the first thing is the carbon dioxide that drives the breathing in people who don't have a chronic lung condition. When you have a chronic lung condition, sometimes it's the oxygen that drops first, but the carbon dioxide is still a factor. Yeah, Jeannie, we got a question.
What happened to you?
You're on mute still.
If
There you
we
go.
have pulmonary fibrosis and the like the walls around the blood vessels in the alveoli are thickened,
Yep.
that would make it harder for the gas of carbon dioxide and oxygen to exchange as well.
Yes, exactly. Exactly. So with diseases that are inflammation, so inflammation can be, COPD, asthma, even pulmonary fibrosis. And then the fibrosis itself, which is a thickening of the tissue, makes it a lot harder, whether it's thickening or inflammation. It makes it a lot harder for the gas to go across the lungs from the blood into the air that's in our lungs and back and forth. And so because that process is slowed down, it's less efficient, we get short of breath more easily than other people. Yeah. Let me know if, is this making sense? It's kind of technical.
Mhm.
Nodding head.
Yeah. Okay. Yeah, so it's both. So it can be the carbon dioxide and or the oxygen. And the only way to really know what's happening in the minute in that situation is to draw a blood sample at that time or to use some monitoring tools to get that information. Yeah. But luckily, as we are running into these shortness of breath episodes, these breathing emergencies, it doesn't actually matter which one is the problem for the most case, because the steps to treat it and deal with it are very, very similar, with the exception of actually adding oxygen if that was the problem. Okay. We okay? I'll moving on. That was a lot. I feel like we need a breathing breathing
Let that all
space.
settle in.
Yeah. And just ask questions anytime. I see some thinking faces. All right. So with that explanation, let's talk about some of the reasons why we get a breathing emergency. And I will start by saying there are so many things that can cause a breathing emergency. So as we all know, breathing is very important. It's also tied to our heart and all of our organ functions. So if anything goes wrong with kind of any of that stuff, sometimes we feel it in our breathing. But these are some of the more common ones that we tend to see. And some of these happen not in isolation, they happen in combination. So usually it's a combination of things that causes the problem. So one of them is overexertion. And overexertion doesn't have to be something you're not used to doing. It can just be something you've done in that moment and it was too much in that moment. So even if it just gets hotter out and you're trying to go for your same walk, that might be overexertion. So keep in mind that it doesn't always have to be some elaborate thing that you're doing. Even if you're just rushing a little bit more than usual, that might be enough to push things over the edge.
Mhm.
Stress or anxiety. Our emotions do affect our breathing. And sometimes when we get stressed or anxious, we don't breathe properly. Our breathing mechanism, the way we're moving air, doesn't happen as efficiently. Like we're breathing a little too shallow. We have a bunch of air in our lungs that's not going in and out, it's just sitting there, and we're only exchanging some air. So when we get anxious, we tend not to breathe properly, and that alone can cause a breathing emergency, or especially if it's combined with one of these other things. Mucus buildup. Bev was just mentioning that. Mucus buildup, it gets in the way. It gets in the way of moving air, especially if it was kind of on its way up, but it didn't fully come out. Or if it's sitting in the bottom and it's getting in the way of that gas exchange. So the oxygen and carbon dioxide have to go across the lung tissue and through mucus if it's there. So it's going to block things from happening normally. A flare-up, asthma and COPD especially, these conditions have flare-ups or exacerbations, or like a lung attack, usually caused by some kind of trigger. For asthma, it's often allergic. COPD, it's often an environmental thing. Could be a change in weather. Doesn't have to be anything complicated, but these things cause us to have a breathing emergency sometimes. Infection, whether it's viral or bacterial. Pneumonia is one of the most common ones, and this can cause us to have a breathing emergency. Heart failure, what we call congestive heart failure, which is a buildup of fluid in the body that can make the lung tissue a little thicker, and it doesn't exchange gas as well. Generally, people who are having heart failure know they have it, so it's not usually a sudden thing that happens, the congestive heart failure. Usually people know they have it, and they might have fluid-restricted diet, and they might have some water pills that make them pee a little bit more. So usually people know they have it, but for some reason, there's just like pushed over the edge a bit with too much fluid in the system. Blood clot in the lungs. So the technical term for this is a pulmonary embolism. And this usually happens in the legs, actually. We get clots in the legs called deep vein thrombosis. And if we get clots in the legs, it usually happens from sitting for too long, like being quite sedentary, especially people who take long airplane flights are at risk for that. So just moving the feet and having the muscles contract actually keeps the blood flow moving in your legs and your lower legs. So that can help decrease the chances of getting pulmonary embolism. So if there is a blood clot in the legs, it can travel into the lungs. The lungs tend to be a filter for that. Sometimes it causes a little bit of pain in the chest, but sometimes it's completely pain-free. We just feel that our breathing is worse. Or it can be any other body system that affects your breathing, primarily the heart, but it can also be metabolic, like diabetes, or kidney related. Jenna.
Yeah, so we just had a question in the chat in terms of phlegm and mucus. So what steps should we take when we start to notice phlegm or mucus starting to build up in the lungs? How can we prevent it from getting worse and becoming an emergency? So really great question, Mitch. And I think you've hit the first part, which is to notice, and then the second part, which is to take action. So noticing can sometimes be the hard part. But once we've identified it, we want to clear mucus as best as we can. And some of you may have mucus clearance techniques that you're doing on a regular daily basis, or maybe they're just techniques that you do when you feel like you're entering a flare-up or you're starting to notice it a bit more. These are things like active cycle of breathing, controlled coughing, the Aerobica, a device that you can get, an oscillatory device with essentially back pressure that helps to stent open airways and help the mucus to move up where you can cough it out. In addition to that, your regular inhalers will be helping if you're on anti-swelling inhalers, anti-inflammatories. That's trying to reduce swelling, which in turn will reduce potentially reduce mucus production. So just make sure that you're taking your maintenance inhalers on a regular basis. And then you've got quick acting inhalers you can take in these times when you notice mucus, which is not always what comes to mind when you think of your rescue inhaler. But your rescue inhaler, like a blue Ventolin, for example, will relax tight muscles around the airway, opening the airway, allowing you then to potentially cough out any mucus that you're feeling. We have a video, so I'll put our site, I'll put our YouTube site back in the chat, where we did talk about mucus madness and we had some mucus clearing techniques. So that might be a good video to go back to explore that a little bit more.
Awesome. Great question. Thanks, Jenna. Did we have any other questions about, how we end up with a breathing emergency? And for sure, it's going to happen when you least expect it in a very inconvenient time and place.
Well, that's what I was just going to say. When working in the asthma clinic, this is anecdotal, but I would see this pattern with people who would experience a breathing emergency requiring hospital. There was always a stress component to whatever else was happening. And Tina is going to go into this a little bit more. But the way we change our body when we're feeling stressed, the hunched shoulders, the tension, the shallower breaths, like she mentioned, those really play into it. And often it's like a perfect storm that sometimes comes together with a couple different things.
Yeah, that combination of things, it's like just a little bit of a little bit things are wrong. It doesn't have to be any one major wrong thing. It's just, the perfect storm. Jeannie. Oh, you're on mute again. Sorry.
Years ago, when my bronchiectasis was acute, I learned how to use how to do the self-postural drainage technique from a physiotherapist. And I actually did that for quite a number of years until I found out that the bronchiectasis wasn't acute. But at least having known that technique, I know that it's there if I need it.
Nice. Yeah, it's good. We like to use the term having a toolbox, so you've got this toolbox, this list of things that you know how to do, that you learn as you live with a chronic lung condition, whether it's clearing the mucus, keeping hydrated, getting good sleep, like all of these things work together to keep your breathing in good shape. So that's awesome. You've built up your toolbox, Jeannie. All right, so all of these reasons that we end up in a breathing emergency. Well, next we're going to talk about what to do about it when we end up in a breathing emergency. But we do want to recognize that whatever the reason, even if you know the reason, it's still okay to call for help. So we do want to make sure you call for help when you need it. And we'll talk a little bit more about when you might need to make that decision. All right, so shortness of breath, SOS. And before I forget, that's the title of one of our YouTube videos that tells you how to handle a breathing emergency. So we'll put some more links in the chat for you. So when you do start to notice your breathing has changed and, you start to get that feeling like, oh, it's getting worse, that is a great time to stop and start doing some of these toolbox techniques to manage your shortness of breath before it gets too bad or before it gets out of control. So when you do notice that your breathing has become troublesome, it's worrying you, something is wrong, here are some steps we can take to correct that or to try and fix that. So the first thing to do is to stop what you're doing. Literally stop. Stop walking. Stop making the coffee, whatever you're doing. Just stop and make breathing your number one priority. And I find that we do see that people, they start to get shortness of breath, but they're just going to finish the whatever, or I just need to get to the top of the stairs, or I just need to, no, don't just anything, just stop. So it's, we're busy in our lives. We know you want to carry on with things and not have a breathing emergency. But when you start to get that sensation, stop. Put your breathing first, and hopefully you can nip it in the bud and things will go smoothly. So make breathing your priority. Don't talk. Just put your hand up. So often when we start to have trouble with our breathing, remember we were talking about these signs that other people can see something's wrong. You might look distressed. That would be normal in a breathing emergency. You might have a certain look on your face and people know, oh, something's wrong. And they'll try to help. They might ask questions. Oh, do you want to sit down? Do you want a drink of water? Can I help you? They'll start talking to you. And one of the worst things you can do is start talking, because that uses some breath. It actually creates a bit of exertion. It makes you work a little harder, and we're not breathing effectively if we're busy talking. So just don't worry about being rude. Just put your hand up. Just, just do this. Maybe even close your eyes and go inward a little bit. This can help to make the breathing your number one priority. So, and trying to draw on that sense of calm that you can, bring up for yourself. Just go inside. Don't worry about what's happening in the world. Just focus on the breath. And when you focus on the breath, here are some things you can focus on. So one of the things you can do is take a good resting pose. We call it take a resting pose to calm the breath. And so if you're just standing up and you're not touching anything, we don't want you to fall over. You're supporting your full body weight. If you can lean on something, even resting your hands on something, even resting your hands on your own knees can help with a nice stable stance. If you can sit, sit. If you're just by the ground and you need to get down on the ground and lay down, worry about getting up later. Just get yourself in a nice resting position and let's manage your breathing first. At the end of this conversation here, we might go into a little more detail about the resting poses, but we also have a video on YouTube, and Jenna will pop that in the chat for us, where we talk about some resting poses to calm the breath. And when you get into this resting pose, let's say it's sitting, because that's usually a very common thing to be able to do, is find a place to sit or to lean your back against a wall, and start to use the pursed lip breathing technique. So pursed lip breathing, you might have heard this before. We do tend to talk about the pursed lip breathing technique a lot because it works. It works really well for a lot of lung conditions. Some people don't find it works and they may have other techniques, but this is the one that works for most people. And by pursed lip breathing, we mean we make a little hole in the middle of our lips, like a drawstring on a drawstring purse, and we blow out through that hole. And it's not so small that it's hard to blow out of. It's just a smaller hole to blow out of. And it creates a little bit of pressure in the chest to keep the airways open. And it lets us exhale all of the air. And as you blow out through that little hole, try to make that exhale longer. So you're blowing out all of that stale air that's in your chest. And then the next breath, you get a whole giant lung full of fresh oxygenated air. So exhaling through a little hole in the mouth and then breathing in through your nose. Breathing in through your nose helps, especially if you're wearing oxygen through your nose. It can help for that for sure. But also our handy dandy noses do some filtering. They filter the air. So if one of the things that was causing you shortness of breath was maybe some dust or something in the air, can help to filter that out. It adds moisture and it adds humidity. And those two things help us to exchange the gas in our lungs. So the nose prepares the air for gas exchange in the lungs. So in through the nose and out through pursed lips. And maybe at the end, we will have a little bit of time to go through some pursed lip breathing, but we also, you got it, have a pursed lip breathing video. We'll pop that and link in the chat too, if you are interested in learning a little more about that.
And I'll just mention, because Jeannie was mentioning when she's tapping on the links, it wasn't quite opening for her. So if you're in the Poplar community, we'll post the links to these videos, which are already in the Poplar community. So you can get them that way as well.
Thanks, Jenna. And then the third thing you can do, I would say mostly focus on the pursed lip breathing, but maybe if pursed lip breathing doesn't work for you, or if you're looking for a little alternative or something else to focus on while you're doing the pursed lip breathing, maybe you've practiced pursed lip breathing enough that this is something you're already doing. We hope so. You can also focus on belly breathing, which is also called diaphragmatic breathing. And that's where we want to pull the air deep into the bases of the lungs by using our diaphragm to breathe. So what happens when we have a breathing emergency or when we're feeling anxious is we tend to breathe, I say high up. We're breathing with the chest and you're breathing with your shoulders up. And it actually is not very effective. It doesn't move the air very much because most of the air is in the bases, and that's where the blood flow is too. So you want the air to go where the blood flow is in your lungs, which is the bottom. So we want to relax the shoulders. We want to not move the chest too much, and we want to move the belly. So the belly should move in and out as we breathe, like a baby. Apparently, we all knew how to do this as kids. And then somehow life makes us into these chesty breathers. So try to move your belly when you breathe. This one can take practice. So I do suggest practicing that at times where your breathing feels great. So this is a good one to practice laying down with something like a Kleenex box or something light, maybe even just your cell phone on your belly that you can watch move up and down as you breathe. And at first, you might have to do it quite consciously, but as you get better at it, and try to do it while you're doing other things too, like turn it into something that you're trying to work on.
Playing the harmonica.
Oh, like playing the harmonica, yes. Yeah, belly breathing is great and it's more effective breathing. So while you're doing your pursed lip breathing, maybe you're looking down at your belly and watching that move as your air moves in and out. And so we move the belly outward to create more space and draw the breath in, and then we push the belly in, which pushes the air out. Do we have any questions or comments about pursed lip breathing or belly breathing or resting poses or the hand? Okay.
So I'll just comment. One question I would get in the past is, when you're feeling this breathing emergency and you're breathing a little faster, it might actually feel hard at first to do the pursed lip breathing. So it's actually okay to go in and out through your mouth as you're settling into your resting position, as you're settling into the rhythm and the belly breathing. In and out through your mouth is okay, but then try to get it in through the nose, out through the mouth, once things are feeling like they're calming down.
Good point. Yeah, breathing in through the nose can be a challenge in an emergency. Yeah. So some techniques might be to take, 3 breaths through your mouth and 1 through your nose. 3 through the mouth, 1 through the nose. And then as your shortness of breath starts to resolve, maybe you do 2 through the mouth, 1 through the nose, and then you switch it up 1 and 1 until you maybe get to the point where it's just all through your nose. And it's nice to do that too, because you'll notice this gradual improvement in your breathing as you're able to take more breaths in through the nose, which can be, reassuring that things are going in the right direction as opposed to the wrong direction. Jeannie.
Check on diaphragmatic breathing, our pulmonary rehab nurse has often said to put one hand on the chest and the other hand on the belly. And as we do our deep breathing, that our hand on the chest shouldn't be moving, that it should be just feeling the breaths from our belly.
Excellent. Couldn't have said it better myself. Thank you. Yep, that's exactly the way.
The other thing that helps too is when you start breathing in, if you count how long you're breathing in for, because as you gradually recover, that time will get longer. And it's kind of a silly thing, but it offers you encouragement to know that, hey, I'm beating this thing because I'm getting better.
Awesome. Awesome point, Alan. Yeah, the counting is really good too. Some people respond very well to that. So it gives something for your mind to think of because like we say, this is a panic situation, right? Your mind is going in circles. I can't breathe. I can't breathe. I can't breathe. But if you start thinking about numbers and counting, it helps. It's a great distractor. And you want to lengthen the breath. So slowing it down. So how many counts can you fit in there? How long can I exhale for? How long can I inhale for? Awesome. Thanks, Ellen. Yeah. It's, sometimes it's about just convincing ourselves that we know how to breathe. We do know how to breathe. We just have to put the focus there and do it. Yeah. Yeah, in the moment it can be hard. So doing these things, all of these steps are directed for anybody. I'm going to go into some other kind of specific things that might be available to some people, but all of these steps should be available to anybody with any lung condition. And the more you practice this, the better you'll become at it. And the more likely it is to become just sort of an instinct that you'll just do it when you need it. Because when things start to happen, if you haven't practiced your plan, I mean, you don't want to be like, where's the video of that Better Breathers Club that I'm supposed to be doing, right? You want to just know it and have it built in. So if there was one slide you were going to take a picture of today, this is the one I suggest. All right. All right. Other strategies. So those ones are great. Those are the main ones, but you might have some of these other strategies available to you. So if you have an inhaler prescribed, a rescue inhaler or quick relief inhaler, like Jenna was mentioning, the blue one, you can take that. This is a good time to take that. And this is probably a good time for me to mention action plans. So we can't fit everything into one talk. Oh my God, I would love to have one giant talk. But action plans are something that a respirologist or your GP or nurse practitioner and respiratory therapist can help build for you. So this is something that your respiratory care team would build with you. And it's got sort of this red light, sort of green light, orange light, red light pattern for you specifically, and it's got different things to do to manage your breathing. How you manage your breathing on a good day, like maintaining your lungs, which hopefully prevents these situations from happening, and then what you need to do to escalate it. And in there is where you'd find instructions about using a quick relief inhaler or maybe some other medications as well. So yeah, a quick relief inhaler, now is the time to use it. If you're having a breathing emergency, go ahead. Oxygen. If you've got oxygen, make sure you've got it on. Make sure the tubes aren't kinked. Make sure it's on the right setting. If you're able to turn it up for mobilizing, turn it up if you've got that extra setting to go to. And then really focus on breathing in through the nose if it's going through your nasal cannulas. So really try to get those breaths in through the nose. If you're a bit panicky and your body is just, it needs to breathe through the mouth, you can take the nasal prongs and put them in your mouth for those breaths in through your mouth. Okay, just for this emergency, go for it. You want the oxygen to be there for you. And if you have been prescribed nitroglycerin spray, if you have angina, and if you're having chest pain during the breathing emergency, the nitroglycerin spray can help Don't forget about that one. And then if you do have an action plan, follow the action plan. If you're having a breathing emergency, look towards the red zone. You can go from green to red. You don't have to go through the orange zone. You can just go straight to red. Speaking of being in the red zone, let's talk about calling for help because that's pretty much what an action plan red zone is all about. So yeah, when to call for help. Yeah, calling for help is totally okay. You know, and some people, I've heard people that came to the hospital for a breathing emergency and they're like, they felt bad because they're like, oh, I didn't want to call an ambulance. I was like, oh my gosh, never feel bad for calling an ambulance. If you need to call an ambulance, please call an ambulance. If you need to go to emergency, go. Please do. So here are some little signals to you from your body that are signaling you that that it's time to call for help. So I'll talk in a minute about when to do all those steps that we just talked about versus just calling for help. So if your breathing feels dangerous to you or you feel a sense of doom, call for help. If you're also having chest pain, call for help. If you're feeling dizzy, anxious, frightened, or confused, call for help. And all of those symptoms, the dizziness, anxious, frightened, or confused, sometimes those are a sign of that high carbon dioxide that we mentioned. Having high carbon dioxide can lead to these sensations. Also, heart trouble can also cause some of these sensations, like that sensation of doom and chest pain. So even though you might think you know the cause of your shortness of breath, there could be other factors at play that you're not aware of, and those things need to be diagnosed and treated as well. If you're using a quick relief puffer and it's not lasting that long, only a couple of hours, and you have to take it every couple of hours, that is not good. That is not safe. Go and get help. Some other treatment needs to happen.
And I'll just clarify and say when Tina says call for help, call 911.
Yes.
Call 911. These are
Call
all
911.
911 situations.
Yes. And if you are using an action plan and you've been in that orange zone for 24 to 48 hours and you're not improving, that means you're in the red zone and you need to call for help. 911.
You could call for help too. Definitely have, if people are in the home with you or wherever you are, reach out for that. But in this sense, we're saying call 911.
Yeah.
Should have your antibiotics.
So calling for help. So calling for help is call 911. Yeah. When an ambulance arrives, they can start treatment for you right away, right in your home. They can help you with your breathing. They can help you with your oxygen levels. They can give you inhalers. So there's things they can do right away. So do call 911. If you happen to feel that you need to get yourself to the emergency room, don't drive yourself. If you're having a breathing emergency, please, please, please do not drive yourself. If you have someone there who wants to drive you and you feel like you can safely get there without things worsening in time, that's up to you. But the main advice here is to call 911. Okay. And while you're waiting for help, all of those things that we talked about, stop, don't talk, make breathing your number one priority, get a nice resting pose, do the pursed-lip breathing. You can do all of that while you wait for help. So it's nice if help is coming to you instead of you having to travel around. And you can do all those other things if you have them available to you, like taking your emergency inhaler, getting oxygen, taking nitroglycerin if it's there. Yeah. Okay.
All the more reason to call for an ambulance because while you're busy doing all that, you're not going to be paying much attention to your driving. So you're going to become a hazard to everybody else on the road. Call an ambulance.
Yes, from someone who spent a lot of their time driving. Thank you for that, Alan. Yeah. Yeah, you don't want to put other people at risk. Yeah. And if you're with somebody else, they can help you with all of those, ways of calming down, bringing you your inhaler and whatnot too. So if they were busy, trying to drive, they wouldn't be able to help you with that stuff either. So yeah, calling 911 is the best bet. There's we say in our life, oh, there's things you might regret or not regret. I usually use the example of going to the bathroom. I think, oh, should I go to the bathroom? Yes, just go to the bathroom. You never regret going. I've never regretted going. Same thing with 911. Should I call 911? Yes. If that's going through your head, just call them. Yeah.
You might regret not going, right?
Yes, exactly. Right? Yes. So a life of no regrets means calling 911. If you're not sure, call 911. We live in a wonderful country. Yes, there are problems with our healthcare system, but we want you to come in to the hospital by calling 911 whenever you need it. Yeah. Trust me, people are in the emergency room with way less emergencies than that. If it's your breathing, put your breathing first. Call 911. I think I've reinforced that enough here. The what?
I had little ambulances going up on my screen.
Oh.
I'll try and do it again. I wanted us, Tina, if you don't mind, and everyone, as you think of your questions, let us know. You could put them in the chat. I just wanted to circle back to Rick's question about exertion and the feeling of fatigue, even though oxygen levels were okay in his example.
Sure.
So yeah, so Rick, like Tina mentioned, we've got two systems at play, both the oxygen and the carbon dioxide. Now, one thing to know about the oxygen levels and your oximeter. So your oximeter does its best, but it's not perfect all the time. And when oxygen levels start to go down, they might start to go down slowly, but there's a certain point where they kind of will go down a bit quick. And depending on that, when you put that oximeter on, you have to be quite still. Your hand has to be steady. And it's only giving you that picture of your oxygen levels in that point in time. So in your example, when you were outside and then maybe you come in or what have you, the levels can be slightly different. But that's not to say that many people still will experience a lot of fatigue in the muscles and that low stamina. And so some of that may stem a little from the oxygen, but it can also stem from a bit of buildup in the muscles as well. Anything you want to add?
I think that's good. Is there any, can we elaborate on anything else there, Rick?
Is there any
Mitch?
correlation? Is there any correlation between the oxygen therapy? Like my last two pulmonary tests, I don't qualify for oxygen under Fraser Health's guideline. However, if they put the slightest slope on there, I would never make it up the hill. So it's kind of a false test in some ways. That for where I live, I don't even walk across the street to the church because the slope is too much for me. When I get in the door, I feel I'm going to pass out. But walking on a level floor, I can gauge myself, and I do the deep the proper breathing and techniques as I'm doing that. So I can walk in and sit down, and I might be at 91 or something like that when I check, but I still feel really beat. But like today, just doing what I was doing, the biggest things was just moving some of the people's big trees and pots so I could move things around, but I sat down on the Allen wall and just Allen block wall and breathed for a while till I thought, okay, so my oxygen level is okay. But I stand up and with pressure wash, I mean, you're standing up, so it's so simple to do the breathing techniques while you're standing there. But there should be a correlation to understand how much the muscles are giving off CO2 or something as opposed to the rate of oxygen coming in. And if there was a way to understand that, And, you know, like we have oxygen to help do the oxygen therapy, but we don't have a vacuum to suck up the CO2 to help us. So I don't know if there's a trick in there that I've never
Yeah.
heard of, or it's,
It's a
Um,
good question, and it's so
Good question.
there's lots of different reasons in our body for the situation that you're explaining. Very quickly, you can talk to your doctor about it. There is a test called a CPET, so cardiopulmonary exercise test, that kind of looks at your oxygen consumption, you know, what you're taking in and what you're putting out in terms of aerobic activity. And sometimes that gives good clues. But you're right, when it comes to the home oxygen testing, it's so complicated. And you're absolutely right. The test doesn't reflect your real world activities, right? And the reason for oxygen is to help people kind of do their activities of daily living, but the testing isn't really set up to explore it in that way fully. So yeah, but I just wanted to quickly mention that CPET test. Like, it's worth talking to your doctor about your situation and just say you're curious and see what they have to say about it. It's not an easy test to get into because not all facilities do it, but
okay, what is that test called again?
I'll put it in the chat. Yeah.
Okay, thank you.
Yeah, cardiopulmonary exercise test.
Okay,
Or exertion test. Yeah. And the other thing, you know, another test that you probably wouldn't have done, and it probably won't serve you any purpose, but it's the VO2 max is something that gets talked about with athletes. And that VO2 max is like the volume of oxygen that your body is capable of taking in and giving to the muscles. And so with living with a chronic lung condition, your VO2 max would be lower because the oxygen isn't coming in across the lung tissue as normally it would. And so that does limit the exercise capacity. And that's what you're probably feeling, is that when your body has this quick need for oxygen, your body, like your lungs, can't supply that well enough. But there is a couple of techniques you could try. So I'll tell you about those now. And I would like to know if it helps.
Okay.
So one common reason I would tell people about this is people who have trouble climbing a full flight of stairs in one go, right? So let's say you can get like a certain amount of the way up the steps and then you've got to stop because you're so short of breath. And we don't want people to get to that point where they're so short of breath. So one technique is pacing. You can just go up the stairs more slowly, even very, very slowly, pausing on each step. But another technique is with the carbon dioxide and oxygen levels, you can kind of bump up your oxygen a little bit and drop your CO2 a little bit before you do something exertional. And that can help decrease the amount of shortness of breath you feel during a short activity, like moving giant pots of plants, trees around. So you could try that. So if you're sitting on that little Ellen brick wall, and you know, oh, I got one more pot I gotta move, or I just have to, you know, do that
okay,
a little bit for another 2 minutes. You can breathe first. So breathe effectively first. I don't want you to hyperventilate. I'm not talking about that. I'm just talking about a few breaths that are really effective. So sit up tall. I want you to get a lot of room for your belly to breathe. This is
Yep.
the perfect time for
Yep.
belly breathing. To make sure you're doing it right, again, following Jeannie's instructions here. One hand on the chest, one hand on the belly. And you can do the pursed lip breathing at the same time if you like. So you're breathing in through the nose and out through pursed lips. Really long exhales. And if you take about, I'll say 4 to 5 of those breaths, just focus on your breathing. Just take a few of those. Maybe you're breathing like they're slow breaths. So maybe it takes you a minute or so to get those few breaths in, and then try the activity. And you might find that you can do it a little more effectively, especially if you keep pursed lip breathing while you're doing the activity, there's a little tip too, you might find that with a little bit of pacing, you can get through it more easily. Yeah, so breathe first. It'll bump up your oxygen a little bit. It'll blow down your CO2 a little bit, and it gives you some buffer time for a short amount of time. It's not going to give you 10 minutes, but if you're just doing something for a minute or two, you might not even get short of breath.
Okay.
Yeah.
So my takeaway from this is basically, if everything else is manageable, CO2 is probably the biggest culprit when you're exerting, because if you're doing all the breathing properly, and when I did have my concentrator on my back, I didn't really notice a big difference, but I could have that on. But I would still tire out, maybe not quite as quickly, but it's just awkward working with that, even with a special harness on with that. So, but nobody's really talked to me about the CO2 thing. I know the pursed lip breathing is to help expel additional CO2 as opposed to regular breathing. But nobody's given me a correlation as to, okay, so how much CO2, how do we become more focused on that if you're active? Because I can't sit and watch TV and do stuff like that. It drives me batty. So I'm always doing something. So
Nice.
I like to
Yeah.
learn,
Yeah, and like you said, the oxygen, we can give oxygen pretty
Yeah.
easily, right? You can have extra oxygen, and there's no vacuum to suck out the CO2. And sometimes that's the problem. Yeah.
Okay.
They go
makes sense.
hand in hand. Some lung conditions, we find that oxygen is the problem. Some lung conditions, we find that CO2 is the bigger problem. So it can depend on your particular situation, which one might tend to be the problem more often, but they do go together.
Okay.
Yeah.
I just like to note we're just at 7 after the
Okay.
hour, but we usually tend to go over a little bit. I know Jeannie has her hand up, so if there are any other burning questions, feel free to put your hand up. We'll get to them, or you could put them in the chat. Let's just go for a couple more minutes. So Jeannie, why don't you go next?
I have two comments. One, dealing with the oximeter. I have Raynaud's where my blood circulation is not too good. So I find putting the oximeter on the thumb works better to get a reading than the finger. And secondly, when Tina was talking about climbing stairs, my technique when I think about it, more so rather than so when I think about it is to mindfully think that I need to exhale on the inhalation of the climb on the stairs and then catch an inhale in between, rather than, getting halfway up the stairs, being totally out of breath and, then kind of panicking. I find the steps that are steeper, that's where the problem occurs. But when the steps are shallow, I'm okay for going up 8 to 10 stairs. But if the steps are steep, I'm lucky to get up 6 without getting short of breath.
Yeah, thank you for sharing. Yeah, it's those, it's our quad muscles, the muscles in our thighs and our upper legs. Those are big muscles. They need a lot of oxygen and they can produce a lot of CO2 when we get going. And stairs is a pretty common issue for people. Yeah. Okay, we got one more slide. All right. Can we prevent this? Okay, it's nice to deal with it nice to know what you need to do to deal with it if it happens, but prevention is the key here. We're primary care, prevent, keep people healthy, keep people breathing. If we can avoid problems, let's do it. So can we prevent it? Well, living with a chronic lung condition, I will say maybe not 100%. Right? So it might still happen despite your best efforts. So don't feel badly if it does happen. Use it as a learning tool. Maybe your lung condition is changing. Maybe something else is happening in your life at that time. So here are some key things you can do to keep your lungs healthy, clean, and easy breathing. So medication, especially inhalers, or anything to do with your breathing, any medication that's been prescribed to you for your breathing condition, take the medication as prescribed. And that might mean taking them when you feel fine. It's keeping you feel fine. That's the goal. So don't wait and see, oh, did I really need that medication? Just take it. Okay, Elaine, I see your hand. I'm gonna keep going and then okay, go for it. Go for it. You gotta unmute yourself. Oh, you're still on mute, Elaine.
You have to go, Elaine? No.
Oh, you're on mute. We can't hear you. There you go.
I hear all this background talking. Is
Okay.
anybody else hearing that?
In terms
Oh,
of mucus, one thing I thought I would mention.
now I do. I think it's
Um,
on, you know what? It's probably one of the videos is playing on your computer.
Yeah. I mentioned,
Yeah.
You know,
No on
mucus
hers.
can
Yeah.
come, both are
One of the
up
videos is playing in the background, Elaine.
and
So is that
and
something I can
mucus is
stop?
denoted
Yeah,
as-
only you can stop it.
So when we think of our airway, sometimes we naturally just want to think
And where on earth would that be?
kind of
There's
remember
another tab open.
connected.
There you go. Oh no.
And that tissue that produces
Okay, if I'm
One
the
of the
only one
links.
that can hear it, that's okay.
Yeah.
lower.
Okay. Okay.
Um,
All right. So, yes, take the medication as prescribed. Keep your vaccinations up to date. This one's good. You don't want to get flu, pneumonia, COVID, or RSV. Take those vaccines on schedule. Mucus clearance. We're coming back to mucus clearance here. So get a mucus clearance routine. It's too giant of a topic for us to cover right now, but we have a video. We had a talk about mucus, a full hour about mucus. So I'll put that link in there for you. I think it's already there. Yes, figure out what your lungs need and do it regularly. And if you're getting little bits up every day, then it's worth it. Pulmonary rehabilitation. This is where you learn about all this stuff, actually. And then regular exercise. So pulmonary rehabilitation and regular exercise go together. You learn how to manage your condition and you learn how to exercise properly for your level of fitness. And you've got to keep on doing all those things and keep on exercising to get the benefits ongoing. Smoking cessation. If you do smoke, try not to. do quit smoking, and if you need help with that, we have certified respiratory educators. We are certified respiratory educators, and we can help you with that. If you live with someone who smokes, perhaps getting them to smoke outside, and even forest fire smoke, there are some really good techniques to keep your home nice and filtered and get the air as clean as we can. So smoke can be a trigger. Other triggers like allergies, finding ways to identify those allergies and reduce them. Eating a healthy diet. You can actually eat a lung-friendly diet. We've got some videos from with nutritionists, or sorry, registered dietitians. Whoops, sorry. Yeah, about how to eat better for your lungs. So avoiding things that cause reflux, is one example. Eating patterns, so not eating too much before bed. Speaking of which, sleeping well. Get good sleep. Your body heals when you sleep. So getting good sleep patterns, good sleep cycles, and self-care. Take care of yourself. Mental health is so important for your physical health as well. Wear a mask if the risk is high, whether that's being around other people who have colds or being around allergens or triggers. And the biggest simple one you can do is wash your hands regularly. This simple thing really does help. It can decrease your chances of getting sick, which can definitely lead to a breathing emergency. So please wash your hands. Oh, and There we go. So if you're looking for more, do reach out to us. We have certified respiratory educators, respiratory therapists. You can get one-to-one guidance in the clinic, get a free 15-minute appointment. So feel free to call us or email us to book your free appointment. We have a fitness club, which is exercise. It's a monthly membership. You can go to as many classes as you like. Monday to Friday, we have 1 or 2 classes every day. And it's drop-in style, so you don't have to pick one specific class to go to. And this is our last Better Breathers of BC session before a quick break in the summer. So we'll be back again in September, and we hope to see you there. And in the meantime, get out there and live your best lung life. We'll say goodbye to everyone online right now, but we will take additional questions. So feel free to stay tuned here if you're on with us, and we can keep the conversation going.
And just another thank you to BC Lung Foundation. Thank you so much for supporting the Better Breathers Club of BC. I just wanted, Terry had a comment in the chat. So Terry's been using the Breathe app, and we've heard about this app before. Anyone else using the Breathe app? So Terry was just sharing what her count is like for her inhale. For some of you, after you inhale, not in a breathing emergency, but when you're practicing this on your own, sometimes adding a breath hold before you exhale. So if you have an obstructive lung condition like COPD, potentially, or asthma perhaps, adding this breath hold in can be really helpful before you exhale. And it sounds like this app kind of guides you through some exercises with that a little bit.
And I think somebody else had a question. Sorry, no.
Thanks, Alan.
Oh, thanks, Alan. Yes, have a good summer. Happy healing. Goodness.
Yeah, have a good summer, you guys. I guess we'll see you in September.
Yeah, Diane, will we see you at the harmonica thing coming up in a couple weeks? The play along?
Yeah, hopefully I'm trying to get there. I don't know what's happened to my life, but it's like
runs away with you
but
sometimes.
I plan on being there. Yeah.
Okay, awesome. Yeah, sometimes in the summer everything goes sideways, right?
So you'll be sending the link out to everybody, will you?
Yeah, so when the links are out, they'll come out to you on the videos will come out on YouTube. They will also show up on the BC Lung Foundation's website. And yeah, we can email the links out. They're going to be out through our Poplar community as well. So if you're getting updates there, we'll post it there too.
Great.
Okay, great. Happy harmonica playing, Elaine.
Oh, to get back at it.
Yeah, we all do. You're not alone.
It's not improving as much as I'd like.
It's not what?
It's not improving as much as I'd like.
Yeah, I hear you. Yep. And listening to the pros play, it's not rubbing off as easily as you would think.
No.
Oh, what's the app called? Oh, it's called. Oh, the Poplar community or the Breathe app. There's a Breathe app and there's another app called Insight Timer, which is really good too. Insight Timer and Breathe. Yeah.
Wonderful. So you can always, if there any questions pop up after this session, let us know in the Poplar community in the big chat area. We can ask your questions at any time. So please do that. And we will keep you posted throughout the summer and we'll see you in the fall.
Yeah. Yeah, we have other things going on in the summer at Poplar, so stay tuned. Yeah.
Cool.
Well, we'll still get updates, right?
Oh yeah. We're still very much, we have other things planned that you can participate in online too. So yeah, there'll be other conversations to be had coming your way. Yeah.
Right.
we'll let you know. Yeah, if you haven't signed up for our newsletter, you could sign up for our newsletter too, because we often post some of our things in there too. But if
Okay.
you're in the Poplar community, and you are, you'll hear about it there too.
Okay, right on.
Yeah.
Right on.
Okay,
Awesome.
bye.
Thanks. Good to see
Okay.
everybody.
Thank you.
Take care.
Enjoy your summer.
Bye. Have a good summer.
You.
Thank you.